Have you ever paused to really think about what happens behind the closed door of your bathroom? It's a private space, a daily routine we all share, yet rarely talk about openly. But what if I told you that these everyday moments, often brushed aside or rushed through, could actually be windows into your overall health? Those regular trips to the bathroom aren't just about relief. They can reveal vital clues about your body's inner workings. In fact, your bathroom habits might be quietly whispering warnings about serious health conditions, including colon cancer, long before any other symptoms appear. It might sound surprising, but it's absolutely true. Changes in your bowel habits, like frequency, color, or consistency, aren't just embarrassing inconveniences to ignore or hide. They're important signals, sometimes the very first signs that something deeper is going on inside your body. These subtle shifts can be your body's way of sounding the alarm, urging you to pay attention before a minor issue becomes a major problem. Ignoring these signs is like hitting the snooze button on a potentially life-saving wake-up call. You might delay action, but the underlying issue doesn't just disappear. Think about it. When your car's engine light flashes, you don't just cover it up and hope for the best. You investigate, because you know ignoring it could lead to bigger problems. Your body works the same way. Those signals, even the ones that feel awkward or uncomfortable, are there for a reason. By paying attention and learning what's normal for you, you empower yourself. Knowledge truly is power. And when it comes to your health, early detection can make all the difference. So let's break the silence and learn how to decode those bathroom breaks. Your body might be trying to tell you something important. Are you ready to listen? Colon cancer, also known as colorectal cancer, starts in the colon or rectum, parts of your digestive system. Think of your colon like a long, flexible tube. Its job is to absorb water and nutrients from digested food. Over time, abnormal growths called polyps can form inside the colon. Most are harmless, but some can turn cancerous. While anyone can get colon cancer, some people are at a higher risk. This includes those with a family history of the disease, those over 50, smokers, and individuals with certain health conditions like inflammatory bowel disease. But here's the good news: colon cancer is highly treatable, especially when caught early. We hear it all the time in health: early detection saves lives. But nowhere is this truer than with colon cancer. When detected early, colon cancer is highly treatable. In fact, the survival rate is over 90%. This means that with early diagnosis and treatment, 9 out of 10 people diagnosed with colon cancer will be alive 5 years later. However, when the cancer spreads to other organs, treatment becomes more complex and less successful. That's why paying attention to your body and knowing the early warning signs is so crucial. Early detection gives you the best chance of beating this disease. It's time to become your own health advocate. Knowledge is power. Here's the thing about colon cancer. It's often called a silent disease because it usually doesn't cause noticeable symptoms in its early stages. Many people feel perfectly healthy and have no idea anything is wrong. This is why colon cancer can be so dangerous. By the time symptoms appear, the disease may have already progressed. It's easy to assume that if you feel fine, you must be fine, but unfortunately that's not always the case with colon cancer. That's why regular screenings are so important, especially if you're over 50 or if you have a family history of colon cancer. Screening tests, like colonoscopies, can detect polyps or early cancers before symptoms even start. Early detection can make all the difference, often leading to much better outcomes and simpler treatments. Even if you feel healthy, don't skip your recommended screenings. They could save your life. However, as the disease progresses, it can trigger certain warning signs. These symptoms might start off subtle, and it's easy to brush them off as something minor or temporary. But paying attention to your body and noticing changes is crucial. While these symptoms can also be caused by other, less serious conditions, it's always best to err on the side of caution and talk to your doctor. Don't be embarrassed or afraid to bring up these issues. Your doctor is there to help, and early conversations can make a huge difference. Here are some common red flags to watch out for. These are signs your body might be giving you that something isn't quite right. Changes in bowel habits. This is a big one. If you notice that you're going to the bathroom more or less often than usual, or if your routine suddenly changes for no clear reason, pay attention. Maybe you're experiencing constipation, diarrhea, or alternating between the two. These changes might last for more than a few days, and they shouldn't be ignored. Have you noticed constipation, diarrhea, or a change in the consistency of your stools that lasts for more than a few days? Don't ignore it. Sometimes people notice their stools are looser or harder than usual, or that they have to strain more than before. Even if it seems like a minor inconvenience, persistent changes are worth mentioning to your doctor. Blood in the stool. Seeing blood in the toilet bowl or on your toilet paper can be alarming. The blood might be bright red or a darker tarry color. Sometimes it's just a small spot, but other times it can be more noticeable. Any amount of blood should be taken seriously, even if it only happens once. While it might be from hemorrhoids or a minor tear, it's always best to get it checked out. Only a healthcare professional can determine the true cause, and it's better to be safe than sorry. Don't let embarrassment keep you from seeking help. Unexplained weight loss. Losing weight without trying might seem like a good thing, but it can be a sign of something serious. If you notice your clothes are fitting looser, or the number on the scale is dropping and you haven't changed your diet or exercise routine, it's time to pay attention. Unintentional weight loss can be a sign that your body is fighting an illness. Stomach discomfort, persistent stomach cramps, pain, bloating, or gas that you haven't experienced before could be a warning sign. Occasional stomach upset is normal, but if you're having ongoing discomfort that doesn't go away, it's important to get it checked out. Sometimes people also feel a sense of fullness or pressure in their abdomen. Fatigue, feeling tired all the time, even after a good night's sleep, could be your body's way of telling you something is wrong. This kind of tiredness doesn't go away with rest and can affect your daily life. It might be caused by blood loss from the colon, which can lead to anemia and leave you feeling drained. Feeling of incomplete evacuation, that feeling that you haven't finished going to the bathroom, even after you've gone, should never be ignored. It can be frustrating and uncomfortable, and it's a sign that something might be blocking your colon or affecting its function. Pencil-thin stools. If your stools are consistently thin like a pencil, it's important to talk to your doctor. This can be a sign that something is narrowing your colon, possibly due to a growth or tumor. Don't dismiss this change, even if you feel fine otherwise. Remember, these symptoms can have many causes, and most of the time they're not due to cancer, but it's always best to be safe than sorry. If you notice any of these warning signs, don't wait. Make an appointment with your doctor. Early detection is key, and listening to your body could save your life. While the previous symptoms are some of the most common signs of colon cancer, it's important to remember that this disease doesn't always follow a predictable pattern. Sometimes, colon cancer can present itself in ways that are much less obvious, making it easy to overlook or dismiss the warning signs. These subtle symptoms can be mistaken for everyday health issues or even stress, but paying attention to them could make a significant difference in early detection and treatment. The disease can also manifest in less obvious ways which may not immediately raise alarm bells. These symptoms might come and go or seem unrelated to your digestive system, but they are still important to notice. Here are a few additional symptoms that, while less common, are still important to be aware of. Recognizing these early can help you seek medical advice sooner, potentially improving your outcome. Nausea or vomiting, feeling sick to your stomach or vomiting regularly, can be a sign of a blockage in the colon. This happens when a tumor partially or completely blocks the passage of waste, causing digestive upset. If you notice that you're experiencing these symptoms without a clear cause, especially if they persist, it's worth bringing up with your doctor. Back pain might occur if colon cancer has spread and is putting pressure on nerves and bones, leading to persistent discomfort. This pain can sometimes be mistaken for muscle strain or arthritis, but if it's new, severe, or doesn't improve, it's important to get it checked out. Anemia, specifically unexplained iron deficiency anemia, which can cause fatigue and shortness of breath, can also be a sign of bleeding in the colon. This type of anemia develops slowly, so you might not notice it right away, but ongoing tiredness, weakness, or pale skin are all signs to watch for. Remember, your body often communicates in subtle ways. Even small changes in how you feel or function can be your body's way of signaling that something isn't quite right. Trust your instincts and listen to what your body is telling you. Pay attention to any unusual or persistent changes, and don't hesitate to discuss your concerns with your healthcare provider. Early conversations and checkups can make a real difference in your health and peace of mind. When it comes to your health, it's always better to be safe than sorry. If you experience any of the symptoms we've discussed, especially if they persist for more than a few days or are accompanied by other unusual symptoms, don't wait to see your doctor. Early detection of colon cancer offers the best chance of successful treatment. Don't let fear or embarrassment prevent you from seeking help. Your health is worth it. Meet Sarah, a vibrant 52-year-old woman who was always diligent about her health. She never imagined she'd be facing a cancer diagnosis. During a routine colonoscopy, Sarah's doctor discovered a small polyp. It was removed and biopsied, revealing early-stage colon cancer. Because the cancer was caught so early, surgery was all Sarah needed to treat it. Today she's cancer-free and living life to the fullest, a testament to the power of early detection. Sarah's story highlights the importance of regular screenings and listening to your body. It could save your life. John, a 60-year-old businessman, had always been healthy and active. He ignored the subtle changes in his bowel habits, attributing them to stress. By the time John experienced severe abdominal pain and sought medical help, the cancer had spread to his liver. He faced a grueling battle with chemotherapy and surgery. John's story underscores the importance of recognizing the early warning signs of colon cancer and seeking medical attention promptly. Don't delay, your health is precious. There are many misconceptions surrounding colon cancer. Let's debunk some common myths. Myth: colon cancer only affects older people. Fact: while the risk increases with age, younger adults can develop colon cancer too. Myth: colonoscopies are painful and embarrassing. Fact: colonoscopies are generally well tolerated and you're sedated during the procedure. Myth: I don't have a family history of colon cancer, so I'm not at risk. Fact: while family history is a risk factor, many people with colon cancer have no family history of the disease. Don't let these myths prevent you from taking charge of your health. Talk to your doctor about your risk factors and get screened. Your body has an incredible way of communicating with you, sending signals every day that deserve your attention. Those bathroom breaks, the subtle aches and pains, the fatigue, they're all messages from your inner self. Don't ignore them, they're important clues. Take charge of your health and make proactive choices every single day. Get screened for colon cancer. It could save your life or the life of someone you love. Listen to your body's whispers, and don't be afraid to seek help when you need it most. Early detection is our greatest weapon against colon cancer, giving us the best chance for a healthy future. Together, united and informed, we can beat this disease.